You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. What if I told you that some of the best business opportunities in public health exist where people don't understand public health? When organizations work in silos and leadership can't see the value in public health connections, that's exactly where entrepreneurs come in. Let's talk about how to spot these gaps and turn them into opportunities. Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines. Today, I want to talk to you about the hidden barriers that exist within our own field. We often focus on communicating public health to the general public, but what happens when the disconnect isn't external? What happens when people who work adjacent to public health, who serve the same populations, who share the same mission, simply don't see the connection? That's the story I'm sharing today. It's about a wellness professional who saw an opportunity and was ready to act on it. Now, in the previous episode, I also talked about an email I received with someone on the topic of wellness. So I'm continuing in that vein, but a completely different story and scenario. This person hit a wall, not because of budget or logistics, but because leadership couldn't see what she could see. For you as public health entrepreneurs, this reveals where the opportunities are. When organizations have gaps in understanding, that's exactly where strategic entrepreneurial thinking can make a real impact. All right, let's dive in. I want to share a story that perfectly illustrates a challenge we see far too often in public health: the failure to recognize the breadth of our field and the opportunities that exist at its intersections. A few months ago, a director of student wellness services at a university heard about an upcoming very large public health conference. She immediately saw the connection and the opportunity. She understood that wellness is public health, and she wanted to attend and represent her department and make those connections visible. So she approached her department leaders with a proposal to send her to the conference. She explained the value, the alignment with their mission, the opportunity to recruit and expand their reach. The response? Well, her ideas were dismissed without any real consideration. Her boss couldn't see the connection between wellness and public health. To them, these were separate spaces, separate fields. The message was clear. That's not us. That's not what we do. Here's what makes this even more frustrating. This same university's formal public health department was already planning to attend the conference. They had a booth reserved on the exhibit floor, so the wellness director saw this perfect opportunity. She could work at the booth, represent the wellness perspective, and bridge these two areas that should naturally be connected. She could show students and attendees that wellness is a part of public health, that these fields overlap and strengthen each other. But because her boss couldn't understand that wellness is also public health, the opportunity was lost. This story reveals something critical about the landscape we're operating in. There are organizations, departments, and institutions where leadership still doesn't fully understand what public health encompasses. They're missing the connections, the overlap, the innovative opportunities that exist at these intersections. And here's what's particularly frustrating. This wasn't even about budget. It never got to the point of discussing whether they could afford to send her. The ideas were dismissed before they were even truly considered. Leadership couldn't see the value in the first place. They couldn't understand how it was relevant to their work. But think about what was actually at that conference. There was an entire wellness section in the exhibit hall. Morning yoga sessions, chair yoga, movement and stretching breaks built into the programming. There's mental health, physical health, spiritual well-being, all represented. The conference literally embodied the World Health Organization's definition of health, not just the absence of disease, but complete physical, mental, and social well-being. This wellness director absolutely belonged there, and she knew it. This is where the entrepreneurial opportunity comes in. Universities and organizations need help bridging these gaps. They need strategies to help leadership understand public health and recognize these overlaps. Because when you can help people see that wellness is part of public health, you open up enormous possibilities. Think about what was lost in this situation. Students at that university missed out on seeing how their wellness services connect to public health careers. Conference attendees missed the perspective of a wellness professional at the public health booth, a differentiator that could have sparked important conversations and connections, and the wellness department missed an opportunity to expand their visibility and impact. From a student perspective, when departments understand these connections, they can better educate students about career pathways. You're not just training someone to be a gym teacher or a psychologist. You're showing them that they could take wellness training into public health spaces or public health training into wellness careers. They can become entrepreneurs and open their own wellness businesses with a public health foundation. They can work in corporate wellness, community health, nonprofit wellness programs. The possibilities expand exponentially. And for universities, there's a practical benefit too: placement rates. When you help students understand the breadth of opportunities in their field, you're boosting your placement numbers by expanding what students see as possible. This story highlights a critical issue. Sometimes the barrier isn't at the ground level. This wellness director got it. She saw the connections, understood the value, and wanted to make it happen. The barrier was leadership. Decision makers who didn't understand the landscape well enough to recognize the opportunity in front of them. This is exactly the kind of challenge where strategic planning and communication expertise becomes invaluable. Someone needed to help that department leadership see that public health isn't just epidemiology and disease tracking. It's wellness, mental health, community engagement, health education, and so much more. And when leadership doesn't understand this, they don't just miss conference opportunities. They limit their department's potential, their staff's professional development, and their students' understanding of career possibilities. There's a broader context here too. Public health has been going through a major shakeup. For some people, when they hear public health now, they immediately think only of disease and vaccines. The light has dimmed on what public health really encompasses. But that means we have an opportunity, and maybe even a responsibility, depending on how you view, to expand that understanding again, to light up the whole room and show people the complete picture. This isn't just one small piece that can be pulled apart. It's an interconnected field where wellness, epidemiology, health education, community health, mental health, and countless other areas work together. And that interconnection is exactly why collaboration is so important. For those of us building businesses in this space, stories like this reveal market opportunities. Organizations need help educating leadership about public health's breadth. They need strategic planning to break down silos. They need communication support to help decision makers see connections they're currently missing. If you're an entrepreneur in public health space, ask yourself, how can I help organizations see these connections? How can I reach decision makers who need to understand this? How can I create value by expanding leadership's understanding of what public health encompasses? Because somewhere right now, there's another wellness director who sees the connection but can't get buy-in from leadership. There's another department leader who's dismissing opportunities because they don't understand the landscape. There's another professional who knows where they belong but can't get through the door. And that's where entrepreneurial public health professionals can step in and make a real difference, not just by serving the people who already get it, but by helping leadership understand why these connections matter. So here's my challenge to you. Look for these gaps. Pay attention to the moments when someone says, that's not public health, about something that absolutely is. Notice when departments are siloed, when leadership is dismissing connections, when opportunities are being missed because understanding is limited. Because that's where you come in. That's where your expertise, your strategic thinking, and your ability to bridge these gaps become invaluable. The field of public health is broad, interconnected, and full of possibilities. Our job as entrepreneurs isn't just to work within that space, it's to help others see it, understand it, and leverage it. If this story resonates with you, or if you're facing similar challenges, then I'd love to hear from you. You can always reach out to us at publichealthentrepreneurs.com. Keep pushing boundaries, making connections, and showing people what public health really looks like. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. Visit publichealthentrepreneurs.com to learn more.